Good evening to all. On behalf of IIP Digital Media team, I, Dr. Uttara Mohan, welcome you to this IIP South Zone Conference Day 3. I also would like to wish everyone a happy World Physiotherapy Day. We are streaming live on IIP India YouTube channel. I request everyone to subscribe to this channel to get regular notifications during our webinars. You can also check for IIP updates on different social media channels such as Facebook, Twitter, Instagram, and LinkedIn. We have been having conference sessions since 3 days. If in case you have missed any of the sessions, you can anytime log into YouTube and view it. Now I request Dr. Rajan Samuel to take over for the session.
Yeah, thank you, Uttara. First of all, I would like to welcome all of you for the first National Reference of Indian Association of Physiotherapists. And this is the third day of our conference and the final day of the conference. First of all, let me wish you all a very happy World Physiotherapy Day. And today we have one of the legendary personality, Dr. Ulrich Randoll, who had given his consent to give a talk about matrix rhythm therapy, its concept, and how it is related to the immune system. So we welcome you, sir, and we thank you for accepting our invitation. And it's a great honor and privilege for all of us to have you here. Before we start the session, I would like to give a small introduction about the speaker. Dr. Ulrich Randoll is a medical doctor, researcher, author, lecturer, and president and scientific officer of Dr. Randoll Institute in Munich, Germany. He is an inventor of matrix rhythm therapy. In 1996, Dr. Randoll was honored with Matrimed Research Award in Greece from the International Matrix Society for his research work on video microscopy, the matrix concept, and first clinical outcomes. He is an invited speaker at various universities and workshops, congresses, and international conferences. His unique matrix concept brings actual evidence-based medical concepts together with evidence-based methods of our ancestors. So with this small introduction, I would like to request Dr. Ulrich Randoll, sir, to start the session. And now the platform is all yours. Thank you, sir.
So I thank you very much for this wonderful introduction. Namaskar to everybody. I'm very honored to have the chance to give a small talk about my work, about the matrix concept, the immune system, and the matrix rhythm therapy. So I'm very thankful to the Indian Society and Association of Physiotherapists, and especially to talk at this special day to all of you. And it's 1 hour, but I try to talk about all these 3 topics: matrix concept, immune system, and matrix rhythm therapy. Unfortunately, we don't see each other from face to face, but I'm very hopeful that in the very near future this will happen. So as you know, my focus is from the field of surgery, and I focused from the structure more and more the processes. And so I'm happy to be now in the field of physiotherapy, where you're dealing with processes. In my life, the last years was always to shift the mind from structure to process. And for example, here on the left side, I just have some cells that we have alive, still alive, and they are working together, they are cooperating together. These are just some muscle cells, and you see these muscle cells are in a certain rhythm. And I just have here, when you have a single cell, and this is just oscillating like this, you know, and you put them together, and at the end you have a big hard muscle, and then you have here at the wrist, you will have the pulse of the body. And so the rhythms are very important in life. Without rhythm, there is no life. And now we have to pose the question, how can we influence these rhythms? And when do we say there are derailed rhythms and the processes behind? This is the talk and the content of the talk at the end. And as many of you already know, I had to develop a special tool. This is the matrix rhythm therapy. We will talk in the third part of my talk. But let's talk now first about the matrix concept. What is it at the beginning? You know, the matrix concept and the systemic medicine. So medicine is going more to a system where you have different parameters, and these parameters are acting to each other, single cells or single people. So the world is full of systems that are interacting more or less synergistically, chaotically. And in this field, we will just figure out what is healthy and what is a disease. And so more and more the system, the matrix concept just started to become reality. So the matrix concept is just a holistic management concept for body and mind. So you see, it's the whole system based on regulation of cellular units under the umbrella of spirituality. So we have everything inside. So how does the mind interact to the cells, to the structures? So everything is connected. But how is it connected, and how something is derailed? How can we influence it by our tools, whatever we use, pills or physical therapy or just sending energy? You know, we are just in this whole field of possibilities, but what makes sense to use if we have a patient in front of us? So it's just a trial to bring an order into the complexity of increasing knowledge of physiology and life sciences for regenerative medicine as a part of modern biomedicine. These are just the words we are using nowadays when we are talking about modern medicine and to develop treatments without side effects. So we hate the side effects. We want just to do something on our patients in the sense of the Hippocratic oath, and so the things should heal without side effect. This is our big wish. And so we have to understand what we are dealing with every day. What is life? What are the cells? How is the function? What is the immune system? And I just want to go with you as a little pass in the next hour to go deeper into these things. So the systemic concept is based on cell biology and actual system theory. So, but we have to be aware that the evolution, that everybody of us, you know, is existing without any science. We are a product of nature and not from any company and not from anything else. We are a product of nature. So our focuses are always man-made. They are artificial, you know. What the reality is of evolution, we will never figure out, but we try. On the other hand, if something is derailed, how can we heal? So it's always the linearity of our thoughts in the big complex system, linearity and complexity. So the system therapy is focusing not at structures, because then life has gone, but processes in between the parameters. So the interaction of people, the interaction of cells, the interaction of animals, you know, these are the swarm theory and all these things where we have the interactions, and the better the interactions are, the better we can say the system is. When people don't discuss anymore with each other, then they have a problem. And the same problem we have in the body when we are talking about the principle of tumor. You know, also there the connection between the cells are not there anymore, and so we need somehow the cooperation, otherwise we lose the character of the system. So, and we have to look for the function and the interaction and the cooperation. So this is what we have to look for when we are looking to the processes. So if we are focusing the time pattern, it means exactly the process and the rhythm. And you know, all of you from your ancient times, you know, you had the Vata Pitta Kapha rhythm of the pulse, and you made systems diagnostic. This has a meaning in modern medicine? I think yes, it has. But so we have to figure out. So, and the space pattern, this is the matter. This is important more or less for the surgeon in the living system. So we have time pattern, space pattern, and this is always linked during our whole life. So it is the concept to regulate the healer within, because what is healing at the end? Can we heal from outside, or can we just condition the processes that the healing takes place? So this is the big question always in medicine: who is the healer? And more everybody comes to the point that we have to activate the healer within with our methods from outside. So with constructive bioinformation from outside to activate the resources of regeneration. So we feel like a farmer preparing the ground so that the plants can, at the end, regenerate. This is healing at the end. So, and what do we have to understand, you know, when we are sitting just like a fisherman at the little sea, you know, so we have to understand the connective tissue. This is the tissue that is connecting all the whole body, and this is the nowadays called the extracellular matrix. And if we don't understand the extracellular matrix, we are fishing in the murky. We don't understand it. It's just driving car in the fog. We don't see anything. We have no orientation. And now my job is a little bit to show you some details and how it can work, especially in together, and where's the immune system? What is the immune system? So now we have different researchers between us and all kinds of medical fields, you know, chemistries and physicists and everything, you know. But all the researchers of all medical disciplines at the end are united in the extracellular matrix, because when you're focusing the single cells, just a metaphor, the fish is in the water, you have to look to the environment, for example. So we have to look for the nutrition. How do we feed the fishes? How do we feed our body? What are we drinking? What are we eating? And the next is, how is the movement of the nutrition in our body? Here, the specialist of nutrition looks how the nutrition comes from one fish to the next fish, or which fish does eat what, you know. Can we just predict what kind of fish will eat what, you know? And the same question we can pose if we inject something into our venous system, which cell will eat what? Who is predicting that? You know, we give a remedy for the liver, but what does the kidney say to this remedy? It is everywhere. Or if we give some chemotherapy, the chemotherapy is everywhere. We cannot say only go to the liver or to the lung or whatever. So we just try to put some stimulations to the body, either from the chemical side, from the pharmaceutical side, or from the physical side. And this is physiotherapy and physical therapies. You know, you work with electrical frequencies, magnetical frequencies, and mechanical oscillations, you know, and how do these vibrations at the end, frequency, amplitude modulated signals interact with the cells, with your body? These are the big questions. And at the end, you know, we can produce coherence or chaos. And now we say, from a certain point of maybe influence, it is a symptom or not. So this is the big discussion, and this shows the whole complexity in medicine. And now everybody is right of these divers, you know, looking from his different perspective to the human body or to the cells, you know. But at the end, you know, the one who shoots the goal in the therapy is a little bit more right than the other, you know. And this is maybe just a question of timing or whatever. These are the open questions. So coming now very concrete to the system, we can say that it is just the extracellular matrix that surrounds the 70 trillion cells, like the body of the body, like the water, the fishes, you know. And what is necessary is the turnover in this aquarium. That means logistics. The logistics means to bring things at a certain place, in a certain amount, in a certain quality, and so on. And this principle, you know, we find also in the human body. You have the cell, and here you have the environment. This is the extracellular matrix, or the interstitial tissue. And here we have the detoxification organ. You see, the detoxification is here by sweating. The sweating is very important to detoxify by the skin. Also, the breathing is very important to get rid of the CO2. And if the CO2 stays in the body too much, when you cannot breathe properly, then you get a so-called hypercapnia, and this brings down the body in a acidosis, and this is not so positive for the cell. So the breathing is very, very important. And then here we have the digestion system with about 300 square meters of surfaces. And here, of course, is the beginning, or here's the biggest part of our immune system. So we have to talk about I will say the mucosal blockage. You know, that means it's just the barrier between inside and outside of the body. And then we have all this is very important to look at the mucosal block. We will go deeper into this a little later. So the microbiome, that means we have more bacteria in our colon than we have body cells. So all of our nutrition we take from the from the gut, I will say, it is digested by the microbiome. So we have to start to think also preventively about the microbiome when we're talking about the immune system. So we have to look to the right nutrition, and I will just tell you the fresh nutrition will be always better than the I will say the fast food things, because then you have a not so good microbiome, and this interacts directly in this worsening the character of your immune system. So the logistics of the ECM estimate the healing processes. Here you have the arterial flow inside, and here you have the venous flow outside, and this is now the area where everything takes place in the micro area of the body. So, and these areas have a certain rhythm, and not only the macroscopic, I will say the slow rhythm, but they have also the membranes here and the membranes around the cells. You see here in the model, this is from the Professor Grubmüller from the Max Planck Institute. He's a mathematician, and these are models from mathematicians, how they see cell membranes. So everything is shivering, everything is vibration, but it has to be coherent, not chaotic. It has to be coherent. And if we lose coherence, then we get problems, maybe like leaky gut syndrome in the colon and so on. So the logistics around the cells is mandatory for everything. And how can we reach this? So just in general, what is life? Life is a process and not a structure. When we have only the structure, the system is dead. So everything is processed, and is in motion. And the process are always in principle the same, but at the end, every second, it is a different one. So the diseases are derailment of processes. So it's this, so a human being is not here disease and here healthy. It is the same, but the process is somehow derailed. And how? Now the question is, how can we reattach the system back to normal? This is what we have to do as therapists and doctors in all kinds of medicine. We see, and which tools are we using for this? So diseases are adaptations to a wrong, unphysiological environment. So if you are limping, or if you are walking in a wrong way, or doing sports in the wrong way, so you have an overload, you have a stress, and at the end an inflammation, and then to this wrong walking, you have just getting pain, and we say now a symptom is coming. So now we have to start another walking, and so the symptom will disappear. This is in a short way said what we are doing every day with our patients. So healing is adaptation of derailed processing, nothing else. And where does the healing start? Always on the cellular level. And this is cell biology, what we have not so much in focus. So we have to understand this, the logistic around the cell. What is logistic? So this is a well-known example, but I show very often. So this has to be very, very, very exact. So life is forming space and time pattern, and everybody is like that. You know, it has to be at the right time, in the right quality, at the right place. And if you are coming too early or too late, then of course the problem is coming. So the question we have to pose is, how many diseases are just produced by derailment of timing? And how can we shift back the timing, the process, and the system will become normal? So life is a highly condensed and ordered information. During evolution, we got more and more information into the system, and so we are far away from the so-called non-equilibrium, where I come now to this point also. So it's a permanent energy demanding system. That means we need, the cells have to get nutrition all the time. We need the fire in our body. We have to burn in our body. And so, and if we have nothing to burn, you know, no proteins, no fat, no glucose, then we get a problem. It's a permanent energy demanding system. We need the metabolism to sustain our structures. So, and this is in the non-equilibrium, and this I will explain now. It's a very important picture where I'm coming to now. That means the symbol of a human being is just like a candle, and the life is the light, you know, and the metabolism is just here, the wax of this candle. And if the environment of the whole candle is changing, then you get a different light. And what you are admiring at your partner, you know, it is the fire, you know, how vital is your partner, or how vital is your dog, or whatever you are just looking at. The vitality is a question of the length of the flame, I would say, you know, and this is depending directly from the nutrition, from the state of relaxation. So if you are in the burnout, for sure the flame is very short and not long anymore. And if the environment is getting worse and worse and worse, at the end it disappears, and then we have the dead system. And so it is everything oxidized, you know, and this means that nothing is burning anymore, there is no metabolism anymore, and then we are just here in this state. That means to stay alive in the living state, we need permanently energy, and this is coming from the nutrition, of course, but also from the sun. We can get energy from the electromagnetic fields. We can get energy. This is very important. This is why you can say that when the sun is shining, people are less depressed as if it would rain, you know, and cloudy and so on. So what does the light do with the body? So we don't have only the metabolism, we also have the radiation, that's interaction to the body, the physics. And what happens now? We have two states in the living state. The ergotroph state with flight and fight, this is the daytime, and in nighttime we have the rest and digest. And you see that we are charging our batteries during nighttime, and in the morning when you are waking up, the batteries are totally full. And then you have the trophotropic side. Then you have you're full of energy, and you can fight and flight during nighttime. And this means, from if you go down to the redox potential of the system, of the chemical systems, they have here the reduction. That means the system gets electrons, and then you are just giving energy. You have the oxidation. This is the reaction with oxygen, and so you are losing the electrons. So what we need to stay alive is always the reduction. That means the electrons of the system. And if we lose too much, then we get all the problems of paining, of inflammation, of tumor, and so on. So when we have understood the basics, you know, then we can explain very easily what happens macroscopically to the symptoms. And so we need the perfect sympathetic balance, and then we have a perfect immune system. That means when we are all stressed, you know, and just at the moment, if people are not in a proper confidence, you know, then of course they are in a permanent stress, and this is not good for the immune system. So just think there are many more possibilities than realities, and there's always a hope, and everything will change to a better way of life than it might be now. This is what I tell to all my patients. And there's always a hope, and it will change always to better times. And so you have always, you are always in a good confidence. So, and just changing these ideas, you know, to the field of carcinogenesis, you know, we did such work. It was 1994 when we did such publications. You have on the reduction pathway, you have the biogenesis. That means you have in the outside environment of just in the nature, you have pre-membranes, pre-plasma, pre-genes, and during the biogenesis, billions of years, you suddenly get an inside milieu and outside milieu, and then you have the first pro-site, and you have a charge already by osmotic pressure about minus 30 millivolts on this cell. And it's not a cell, it's a pro-site. Yes, it's a pre-cell. And during the symbiogenesis, you know, when the oxygen came to the earth, you know, and this pro-site took the mitochondria into the cell, and by sudden you got about minus 80 millivolts on the cell membrane. So the charge, you know, is directly a result from the function of the cell metabolism. And the problem is now when you change, remember the candlelight, you know, when you just reduce the oxygen, then the mitochondria don't have a respiration anymore because there's no oxygen. And so they start with fermentation, and immediately you come into the cancerous process. What is the conclusion? You know, if we want to have just regenerative treatments, we have to optimize circulation, and especially the hydrogen and the oxygen that we just raise the membrane potential at the end. So I don't want to go too deep into these things, but at the end, stress makes oxidation, and at the end, diseases and relaxation, that means sympatholizes and vagotonic properties, they are important to stabilize it in the healthy state. And when you now focus directly the membrane charge, these are the membranes, you know, a part of a membrane, and here you have about just 10 to the power of 7, you know, volts per meter. This is a very high charged membrane. So these are angstrom or 6 nanometers here, but this is highly charged, and these are our 80 millivolts on the membrane. And just look here, where do we have now the dividing cells? They are below the threshold of -30, and here we have above this threshold, we have the permanent cells that are non-dividing cells. So we have to be very careful when we are applying therapies, you know. Are we just charging the system or decharging the system? This is just the physical explanation, how we can explain just the property of the cells, not on the chemical language, but on the physical language. And in physiotherapy, we are dealing with electrical, magnetical, and so fields. We have to look, are we stressing the system or are we relaxating the system? And when you stress the system, you get a discharge, and when you have a relaxation, and when you are sleeping, then in the night, then you are charging the system. So it's a very simple thing. And the big engine, you know, of the system is the so-called mitochondria. Everybody knows it, you know, because this is producing the ATP in the cell, and 10% of the body weight are mitochondria. This is a tremendous amount of material, and they produce 1.5 as much ATP per day as body weight. So without ATP, we get acidosis, pain, inflammations, immune system deficit, and rigor mortis. So this is the engine of everything. And during our experiments, you know, interestingly, this is exactly 30 years, exactly the day of today, you know, 30 years before I did this work in my video, you know, we just made nanovesicles, and this is important when we are talking today the stories about viruses and in injections and all these things, you know. You have here artificial nanovesicles, and here you have so-called exosomes coming out from tumor cells, you know. At the end, you see here, these are 2, and if you just wait from a certain point, now we have 4, you know. You see, this bubble is just producing some smaller bubbles, and we call them exosomes. And now on this side, when you put artificial nanovesicles into fields, electrical fields, then you see how they are melting with each other. That means if you just look to one of these bubbles, they get less and less and less, and this bubble becomes bigger and bigger and bigger. And so you can just get an impression how these exosomes or nanovesicles penetrate, dependent from the charge into the cell. And what we need nowadays, of course, all the time, is charged surfaces so that the system are stabilized. And this is very important for a stable immune system, in my opinion. This is a very, I think, very advanced approach, but I think this is the way how we should think in future time. And now when we go to the physiological exosomes and artificial nanosomes, they have the same size, the exosomes here, and these are just the artificial ones. They are in the same field, and this is directly dependent from the electrical charge. Either they penetrate inside this way or outside this way. Now we are dealing with physical therapy, and I wanted to show you that we are producing these physical fields. You know, this is the magnetic field of the brain, and here we have the electrical and the magnetic field from the heart. And these fields we can measure with these machines. These are magnetic field measuring SQUID machines, supraquantum interference devices. And 30 years ago, we had them from Siemens company. And interestingly, we had these fields, you know, are 10 to the power of -6. They are weaker than the Earth's magnetic field. You know, we needed special rooms, you know, to get rid of the Earth's field and so on. I only wanted to show this, how sensible the human body is according to external fields. And now we have to think about first the biomagnetic fields in the body. We have the lung, we have the human heart, we have skeletal muscle. So they are all producing, because they are working in a coherent way. They are oscillating, you know, they are producing all electromagnetic fields in this range here. And now we have the environmental fields, the urban noise in the town. Just think about Mumbai or Pune or whatever, you know, you have the urban noise of environmental fields, of electricity, the car, the screwdriver. And of course, we have to think about physical therapies, what we are doing. Are we producing in these biomagnetic fields ordered systems or not ordered coherent interactions? This is what we have to look in the future time. And here you see such kind of surface field on the body, and just magnetical field you just take inductively from the human body. That means the machine is not touching the body, it's coming just like an aura. You can also say electromagnetic aura out of the body. This is, you are always an electromagnetical field. And nowadays I'm amazed, you know, it was 30 years ago that I was able to see magnetical fields from the body. So, and now the question is, how can we interact, and when we interact, how do we interact with the human body? So now we have to deal with the characteristics of the human body, the so-called thixotropy and properties of the body. That means when you have sedimentation rate of the blood is depending from the charge ratio. That means the charge from these erythrocytes. This is, by the way, a granulocyte that is doing its work. You know, here's the protopode, uropode, nucleus, and these are the mitochondria. And you can just guess that this granulocyte is scanning the surfaces and checking if the antigenity is correct or not. And here also, this is charge dependent. You know, when the charge is going down from stress, you know, then you have a contraction of the muscle. These are 3 muscle cells oscillating normally, but when you have stress, then they are just contracting, and you have a cramp, calf muscle cramp. You can have also a heart attack. These are just the cramps. So you need energy to release the system. And this means you need at the end the electrons, and they come from metabolism, from ATP, and so on. So oxidization is not so positive. Here you see the synchronous oscillation, and here you see they are just stick together, and this granulocyte is just trying to bring them out. And when now the pH is changing in the blood, you have the same cells, but they are clogged together, and also the granulocyte cannot work properly. This is stressed blood, it doesn't work properly anymore. So the best, and that means the whole immune system and the immune cells are contracted, they cannot do any more the work. So what is now the consequence for our therapies? Calm down the body, take the right nutrition, have enough sleep, go to meditation, and just go into the field of hope, and everything will become better. If you stress the body, you do just the opposite, and this will harm in the long range. This is the message, the main message of today. Calm down the body, and then you will get a very good immune system. That means also here, the higher the colloidal pressure, the albumins and globulins that are here in the lumen of the vessels, when there is a lot of these proteins, then the less plasma will escape from the vascular space into the extracellular space. So if there are only few albumins, you know, then you have the swellings, the edemas, and all these things. And when the skin surface cools down, that's also important. There's an increase in blood viscosity and thrombosis tendency. So when people get nowadays more, you know, thrombosis in the vessels, you know, this is coming from the viscosity of the blood. So it's important to look to the viscosity. Otherwise, you can get in all kinds of microcirculation thrombosis by a sudden. And to avoid such kind of thrombosis, you have to look for the logistics in the system. That means we need the muscle quivering. This is coming from our basic tremor. We have all our basic tremor, and in extreme situations like collapse, fever, temperature, weightlifter, we are starting directly to synchronize the system, and then we start the 8 to 12 hertz rhythm. Everybody knows it, I think, who is best dealing with the matrix concept and matrix rhythm therapy. And then we get just a flow back to the system. That means the muscle is contracting here and the flow is restarting in the microcapillaries. And so we start just the liquids flow back to the heart. And what does it mean, you know, for the muscle when there's no flow? Then you get at the end just a cramp, and the cramp happens on the level of actin myosin. So you have no a space of movement in between here, because you have the contraction here. That means a muscle that is contracted, for example, a biceps muscle that is contracted can only hold but cannot speed up, because there's no movement anymore on the micro level. So the relaxation takes place not just by stretching. This is a little bit insufficient when you do just the stretching, even by yoga. You have to release the system on the actin myosin level, and so you need kind of massage techniques that is activating the metabolism. And then, of course, you get a loosening of the actin myosin and heads here. This is how you just loosen the body. If you just stretch such a muscle here, you will always stretch at the weakest area, and at the end, the muscle will rupture. And this happens very often in the people that are doing sports. So going now to the frequencies of the body and the time pattern, you know, we find beta, alpha, theta rhythm in the brain, but also the heart and the breast and the skeletal muscle. And this is what we are focusing in physical therapy and in our matrix device using 8 to 12 hertz. And important is that we have always ranges, you know, not fixed frequencies. That means natural rhythms are always in variability. That is also why we are measuring in sports now the heart rate variability as a measure of healthiness and not the heart rate constants, you know. The lack of variability and lack of elasticity are signals of disease, and there are coherent physiological rhythms, master clocks of living processes. This is the big question. And now I come to the treatment directly. We have magnetical and mechanical activation with this crank handle, you can say, and with the entrainment process, you know, you just come from outside and like a starter in an engine, and you start the muscle quivering in the range of 8 to 12 hertz. It is the synchronization of cells, organs, and organisms by external rhythm. We go to the time pattern with physiological rhythms, and this is just the frequency range the body knows, so it is not strange, and so you don't harm. And so we readapt physiological processes. So external rhythms, it's like with a crank hand, engage internal rhythms to arrange them and their corresponding metabolic processes as well, because every rhythm is like the music from an orchestra that is playing a symphony, has to come from a single musician, that means from a single cell. Cells make the body rhythms, and musicians make the harmony of the symphony. So this is the analogy. So mobilization, how do we start now? And this is very important, that healing starts, as we mentioned already, from the micro level. We start with the metabolism, and then when the metabolism shows us a certain elasticity, we start with the macro movement. So the treatment means from micro to macro, from passive to active. That means at the end, the patient himself or herself is directly doing the movement in a smooth transition. It should never harm, because if something harms, then we get problems. And this is also inductively using magnetic things. So the lady that is just here, you know, and we treat her, was this year is the same. This was 2080 before the therapy. She had a horrible scoliosis, and because she was a competitive swimmer, and she had a growth sport, and then it came immediately the scoliosis. And here you see after one treatment, and this is now December 19. And what happens, what I mentioned before, when you have contractions on one side, you know, then the other side is growing, and immediately you have your S-curve or whatever you have in the muscle. It means you have to release the muscles in between the vertebrae, and then you get a normalization of the vertebrae here, and then you have a normal growth. And of course, after having mobilized it, you can stabilize it by orthesis or whatever you want. This is dependent from the degree of scoliosis. So the immune system happens in the ECM. You need the logistics there. I don't have to repeat it. You have to just activate the response or the logistics in the extracellular spaces. And then, because the most part of the immune system happens there. And the ECM is just the source, you know, for the lymphatic system. Now we have to focus a little bit the immune system and the lymph system, you know. That means 1/10 of the capillary exudate becomes lymph. That means protein, fat slag, red blood cells, and this is 2 to 3 liters every day. And the lymphatic system has to suck in here in these terminal vessels. And then it goes from here directly to the Thoracicus, dexter and sinister, and goes here into the angles in this area. So and now we have to ask, how does the lymphatic liquid come from the feet against the gravitational forces up to this area here? Is it enough, the belly breathing? In my opinion, it's not enough. We have to do the thorax breathing, because only then we get enough negative pressure for that. Here is the ECM, the source of the lymphatic system, and here we have the construction of the lymph node. I don't want to go too deep inside. Those who are interested, you can order a booklet later. I will announce it. You can order it directly in India, where all these things are very nicely written in. I just want to touch it here because time is running, and I see it's already just 50 minutes we have as I see it. So these are the lymph nodes, and here the lymph ganglions. They are also a little bit oscillating already, so that by these valves you get a direction of the lymph flow inside. And the main pump, you know, here again the lymph node. You have the blood vessel that is important for the nutrition of the cells of the lymph node. But then you have the afferent lymph vessels and the afferent lymph vessels. So here it goes just in here, the afferent one, and here it goes out from the lymph node. And what happens here in this lymph node? This is the big marketplace of informational exchange of checkpoints to the T cell activation. So if there's no flow, you know, inside the lymphatic system, we get problems here. And believe me, when a lymph node is working, then of course it is swollen and it is slightly warm. That means just especially in oncology, when we see swollen lymph nodes, it's not just a metastasis, it's mostly just a working lymph node. This I just wanted to say by the way. So if a lymph node is working, the lymph node has to be warm and is mostly a little bit swollen. And then the marketplace is running here in the exchange of all the information that is needed for the immune system. And now this is more important now for us as people that do the treatments. This is the breathing, you know, and the thorax breathing is very important, especially the mobility of the ribs, you know, the costovertebral ribs have to be open here. Every time when you breathe, and if this is blocked, then you have a limited breathing. Also here, when the muscles are blocked here, the ribs do not move and you cannot breathe properly. And believe me, especially in sports people, but also in normal people, when you open the costovertebral joints, you get half a liter or 1 liter more air into the body. Also the diaphragm becomes more elastic. And those who have a reflux, you know, get rid of the reflux because also the sphincter is working in a better way. So just working on the thorax, you know, is touching so many disciplines in medicine. It's unbelievable. Also, the sympathetic trunk, where I come later, is just running paravertebral and that you are touching. So on the microscopic scale, we have the microvibration. I mentioned them already. Then you have a coherent synchronous shivering of the muscle. And this you can activate with the Matrix Mobile, with this machine. And on the macroscopically parallel, you have sucking effects by breathing excursion, the heart pulsation, and the venous pump. And together, you know, we have a very, very nice turnover. And so that is why we have to move every day, but not just walking like old people. We really have to run to speed up so that we are sweating, so that the whole thorax is used. If we don't use it, we lose it. You know these sentences. And hey, this is one of the examples, you know, where you see that even in the year of 97, now this year he is 98 years, that was an inoperable spinal stenosis with gluteal pain and the long both legs. So he had tremendous pain in his legs. He could not walk, and he didn't want to take painkillers because they didn't help. He was just dizzy, and the distance was 10 meters. And you see when you just open the paravertebral joints, you know, how the movement starts again. And these are the areas you can imagine and see it in every book. And the neurosurgeon, they did not want to operate because this was the spine. And so we started with our mobilization in the micro areas with Matrix Mobile. And now you see how he's walking, pain-free, unlimited. And when I tell him just to run a little bit, he is even starting to run, you know. And this was amazing for me, that even in such an age of 97, he has got his trust, he has got his confidence, and his life quality is like 20 years ago. And this can, everybody of you can reach it just by focusing the cellular level, that is a little bit forgotten in normal physiotherapy. I always say, if we forget the cell biology, what happens under the table, we cannot get such nice results just by using macroscopic way of thinking. So treating the paravertebral spine, we touch all the organs, you know. That means all the organs can theoretically be stressed because every organ is balanced by the sympathetic and parasympathetic trunk. And so when you can also have, for example, stress in the liver, stress in the stomach. And when, as long as you compensate with your organs, you are correct. But when you decompensate, suddenly you have just an ulcer in the stomach, or you have colitis ulcerosa. That means these are all decompensations of compensated regulations in advance. And this makes it so necessary that from time to time, do you really relax, you know. We have to go away from the motorway, go to the parking place, and just relax. And additionally, with massage techniques, you know, we slow down the body, and this is necessary to heal the systems, to activate the inner healing. And of course, that means healing means to take the stress out of the whole system. And this I do regularly by treating the paravertebral system. So I mentioned before, not only the movement of the thorax, but also here in the lymphatic system, and also the nervous system is touched. So you have all the three systems are touched. And from the point of segment anatomy, you see that all the tomes are correlated. I don't want to go deep into these things. So this is also an effect when you're treating the sympathetic trunk, that you interact to the whole tomes of the whole body. So these are central systems where we focus regularly. And how are we doing this? Optimizing the logistics for regeneration of nerve function, muscle fascia, decompression of the discs. So this is the way how it works. And it's always in this range because this is the basic range. And you also find it on the Earth's oscillation. The basic vibration of the Earth is also in this range of alpha, you can say. And so when you relax the muscle, you also have relaxation here in the different segments, and the nerves can glide, and so you get rid of the pain in the arm and so on. So the plexus cervical has to be treated, the plexus lumbar, brachial, and lumbar has to be treated also. Here now a lady, she had a horrible Randoll phenomenon since many years. She's a dentist, and she was told to stop her job because her fingers were in those days like that, you know, and she had tremendous pain. And then of course we started the treatment, especially here in these areas of the thorax, cervical spine, and so we get the release of the nerve plexi. And you see these are the two marks, the scars here, how she shifted from here to here. That means the spine is much more right up here, and the distance from here to here is 1.5 centimeters, and here it is fixed. So the whole spine was released, you know, and rightened up, and the distances between the segments became better. And so the nerves were not touched anymore. And so the fingers didn't produce the Randoll symptomatic, and the fingers were fine. And so this was 2012, and now it's 2019, and she's still working as a dentist wonderfully here in Munich. And before, she was told to stop her job because she worked, of course, as a dentist, as you know, with her fingers. Here, another case from dentistry, when we have these arthromyofibrosis after cancer resection and radiation, he was not able to open his mouth, but now you see he is opening actively, obviously with this opener, he's doing the pressure, and I'm just applying here the machine, and what you're seeing is that slowly, the mouth is opening, and after a very short time, he was already able to eat. And this is a wonderful case I always show. This is from our friend Sandy Bhagwat from Solapur, and I'm very proud to have so many users and also instructors in India that are working from the fullest body of the heart in the field of matrix concept. And I really want to welcome you and thank you very much at this wonderful World Day of Physiotherapy. And especially my thanks to all of you for supporting the idea, because this is really wonderful, and this gives me all the time the big pleasure when I see such results. You know, every surgeon would maybe make amputation, or he's lost, because here you already see the necrosis, and here you see very nicely how the muscle and the tissue is really getting fresh. It's reddish, you know, here, so the microcirculation is coming, and just like you know, no surgeon believes this can heal in such a manner. So big thank you for all these cases, and there are a lot of instructors that have so many results, and so I'm thankful to all of you, and really thank you. This is another case, you know, here the trauma case. I just visited him 3 weeks ago, and he's doing very nice progress. Next time I can show the next slide. He was in a vegetative state 8 months, and this was 2003, and he developed epilepsy. The lung control was very bad, and now we are just mobilizing, you know, his legs, you know, his arms, his whole body, because he is he's like totally stiff, because there's no mobility in the area of actin myosin, and before you have not opened these areas, it is not possible to start life. He's in a so-called locked-in symptomatic, and it's interesting that he gets more and more aware what is going around him, and when the elasticity is starting, then of course you can put him on the sarcoma treadmills and start with macroscopic movements. And he is motivated by the trainer, and also here from the screen, he is forced to speed up and to follow this person here. So this is from micro to macro, as firstly passive and then active. And this is the way how we use it in physiotherapy and especially neurorehabilitation. Now, this is some sports people. I have many sports people. This is the group from Switzerland, the national team of bobsledge, and this is the world champion in mountain bike here. And this is these are the wrestlers. These are the strong men in Switzerland that are wrestling. And of course, it's not only a question of the weight. It's how can I speed up my arm, my legs, you know, to be good in these sports. So I'm coming to the end, I think. So what is now the matrix therapy? It activates symbiotic effects on different hierarchic levels, from macroscopic to micro level. It's the cellular basis of physiotherapy, in my opinion, because when you have cleaned the cellular level, then you can add macroscopic all kinds of additional tools. You know, it's just the simulating the physiological muscle tremor to calm down tonus and mind, because the people are calming down in mind and get confidence for life, and the interaction is very important between the therapist and the patient. That means you have always a psycho-emotional and haptic interaction between patient and therapist. That means the machine in your arm, the Matrix Mobile, is as good as the therapist is. It's the elongated arm of the therapist. And of course, you talk with the patient and put him into another life pattern, if possible, and give him hope and change his life pattern, because everybody of us is the end result of the behavior of the life pattern we do. And so we are a victim also of our doing. So if you don't change the life pattern, you will not get other results. We are very often responsible for our diseases. So that it's reducing the stress level on all symptom-specific and unspecific cellular level and hormonal defense system. So this is very important for the immune system, and also the reduction of the inflammatory processes are calmed down. Very important to take the inflammations out of the inflammatory load, and also the mental stress out of the system. And the mobilization, I can only repeat it always, micro to macro, from passive to active, in a smooth transition with feedback control, and it should never harm. It can be combined with, for example, manual therapy, spiral dynamics, also all the yoga asanas, and also osteopathic techniques. Our system prepares the cellular level, and then we are free to do everything in combination. Increasing logistics of the ECE, from the lymphatic and the venous side. This is for the immune system, again, very important, and also for the metabolism. It's removing the edemas, the hematomas, the sticky and agglutinated areas, and all the waste products that are in the I will say, facial pockets around the joints, like the knees, for example. So the blockages in mind and meta are regulated to optimize self-organization in nowadays regenerative medicine. So I'm finished, and so if you need more information about the matrix concept, there is one book in English, and also the booklets are here. And I was talking to Mr. Arnold Despande just yesterday, and he is so kind and will send these booklets directly. If you want to call him. This is about the lymphatic system, and these are the principles of matrix rhythm therapy. And also, when you have, of course, question, you can directly contact here the Dr. Randoll Institute. So he is the responsible man for India, and I'm very thankful to him, because he is doing all his work from the deepest bottom of his heart, and this is what I appreciate very, very much. So I thank you very much. My wish for you is nothing else than stay like a roly-poly, just elastic and relaxed. Thank you very much.
Thank you, sir. It was a very wonderful session, and again, an eye-opener for many of the participants. We could understand the importance of rhythm, and especially the coherence. We could understand that how much environment is very important. By your demonstration of the candle, like we could really understand like how much important is the environment, and the environment that is provided by the extracellular matrix is very important for each and every cell to function normally. And we could also understand that we should have a shift from structural thinking to process thinking. So always we don't think about like problems in the structure. So there could be problems in the process, and we need to go from micro level, start with the micro level and go to the macro, and also start with passive and go to the active. So, and again, we could really enjoy all the videos which you have shown with your real patients, which can make us understand that this particular extended arm of a physiotherapist is really going to have an influence on multiple areas, like for example a traumatic brain injury patient, and a scoliosis patient, and a patient who has difficulty in opening his mouth, and probably like as a stress reliever, so working on ulcers. So likewise it has a multiple usage, and probably like as you said, like it is getting the healing from inside, and it is the natural, we are facilitating the natural system to heal by itself instead of going for a chemical method of delivering a drug or so. So I think it was very interesting and useful session, and I definitely feel that the Indian physios will understand the concept, get into this particular platform, learn more about the concept, and try to use this for the benefit of their patients. And thank you very much, sir.
I thank you. I thank you very much. And then also my thanks to the whole patrons of your society. I'm again very thankful having the chance and the opportunity to talk to all of you. And thank you again for this wonderful invitation. And I hope to see you very soon in India or also in Germany. Come here and we will have a nice time. We will continue our exchange on scientific level. But also, you must know we have the wonderful beer gardens here in Munich. So when you are here, just give a call, and we will do something together. Thank you so much.
Yes.
So I don't know if there are questions, and of course I'm open for questions all the time. So please just tell me how to go on.
So there is one question. The question is the effect of matrix rhythm therapy long lasting? So,
well, this is a very good question. This is it's not nice to give also another question. How long does a service from a car last? It's a question how you drive the car. That means a question how you change the pattern that leaded the body to the symptom. That means when the symptom is just a mismanagement, it means if my hand is a roly-poly and the symptom is here and we take the blockage away, we open it again. And then of course you have to change your movements or your life pattern, your nutrition and so on. And this is exactly what we have to do with the patient, not just work on the body, we have to work on his mind. Otherwise he will come back and say, I have again my pain, and he will make us guilty because our treatment was wrong. So we have to try to make him clear that the mismanagement of the body is the reason for the symptom, or not always, but mostly, especially in our conveniences diseases, I will say. You know, we don't move enough, we eat the wrong things, we eat too much, and so on. So we have to tell the people the manual of life to the people, and then of course the effect will last for the next 5 years. And if not, to many of my patients, I tell them if they come again and again and again and they don't do the exercises, I just tell them, of course you can come as often as you want. If you want to make me rich, come. But if you want to get rid of your symptom, just change your life.
Yes, sir. So,
is it answered? So it's a question, how can I shift the mind of the patient?
Yes, sir. Sir, there is another question on what is the effect of matrix rhythm therapy on tumor?
On tumor. So it's not a tumor therapy, but additionally, for example, you will get rid of or reduce the pain. For example, if you have metastasis, and you can use it additionally, for example, chemotherapy. You can use it additionally to radiation, because and especially in the intervals between radiation, you can use it. We did all these things, you know. That means these are all destructive, aggressive treatments. But at the end, we cannot heal with aggression. We can only heal by supporting the healthy side. That means, so we have to think about nutrition, and of course the metabolism, and of course the oxygen pressure, the whole metabolism. So you can additionally use it for the recreation, I will say. But to make it very clear, it's not a tumor treatment. You can activate the immune system, and maybe if you, for example, in former times, And I use also temperature. I make fever in the body, because especially tumor patients cannot remember that ever they had fever. So I activate the temperature, the circulation, and by a sudden I also saw a tumor reduction by just stabilizing the environment of the system. Because at the end, when somebody has a tumor, a question of the defense system, the immune system, that was too weak. Now we have to ask why weak. Too much stress, too much antibiosis, or whatever it was.
Yes, sir. Thank you, sir. And again, there is a question from a participant. I'm just combining two questions. Like, is there any precautions we should take, and is there any contraindication for matrix rhythm therapy?
So there are just relative contraindications, you know, because the advantage is that we are applying physiological rhythms to the body. That means we are playing to the orchestra, that means to the body, exactly the music we are expecting from the system as when it is healthy. That means when the system is healthy, the body says, well, I know the music, I don't care. But it doesn't disturb me much, because, yes. But if there are blockages, then you open them, sticky areas, you open them. And so, and the rule is you should never harm. So at the end, there are no side effects. And so you can use it in all kinds of problems, because you only have to ask, how is the symptom correlated to microcirculation? At the end, every symptom is correlated to cells. And so you treat at the end just the principle of cells, and this is logistics. You're just treating the principle of the car, of the auto engine. And the auto engine is in the BMW or in the Porsche or in the whatever, the same, nearly the same, yes? So you know what I mean? We are treating principles and not symptoms. We are just treating dysregulations. And now the advantage is that the healing is coming from within. So we all take blockages out and the roly-poly comes up.
Yes, sir. Yes, sir. So that we are working from within, and we are working on the principles and not on the symptoms. Yes.
Exactly. Perfect.
And the next question is whether the matrix concept is effective in pediatric cases.
In pediatric cases, yes, it's wonderful. For example, use it very, very much in cerebral palsy children. So, and if this is done at the earliest point, that means, I will say, some weeks or months after birth, you know, when you have no contractions and you directly start with the stimulation of the afferences, you have to know that the afferences make the brain and not the brain the periphery, you know. That means we have to stimulate the senses, the palms and the feet, you know, and then this will activate the brain. And so reflectorily, we get a release of the system. If we don't stimulate from the periphery, the central nervous system does not know that the body is connected. And so we get at the end a contraction. And this is my observation. When we start from the earliest point and the earliest moment, then you directly, then the relaxation stays. And if you have, and of course you have to think about when the children are growing, then the flexors are stronger than the extensors. And so you have always the contraction here. And so you can also train the mothers. I do it here in Germany. The mothers are trained to treat the children, and I tell them you have to clean the muscles like the teeth. Every day you have to do it because the child cannot do it, and so you get contraction because there's no metabolism. And if there's no metabolism, we get acidosis, and at the end, cramp. This is the normal way how it works in all kinds of ages, from the very old to until the young. It's just treating cell cultures as you see it like this. Everybody is a cell culture, and you have to look to the environment. And if the environment is okay, the children are good, and also the grandfathers.
Yes, sir. Yes, sir. So I think an early intervention will definitely be of great help, especially in cerebral palsy, right, sir?
Yes.
Okay, sir. We'll go to the next question, sir. Does the matrix concept serve as a clinical modality for COVID patients?
I wouldn't, so you can go to the symptoms, you know. If you treat the chest, as I mentioned before, as we see in asthma patients and COPD patients, you can breathe much, much better. And these people are full of stress, you know, because everybody around are stressing them. And even when they go to the clinic, they are nowadays not together with normal doctors and therapists, because all of them coming with the big mask and this and this and this. And every patient thinks the last hour of the life has started, even when you see the environment. And so it is very important. Calm down the body, and you tell them, don't worry. I will not say be happy, but don't worry, and we will find a solution. This will help you, and just go to the breathing, and we will relax your thorax so you can breathe better. Give them additionally just oxygen, and relax the whole system. So additionally, it's wonderful because you release the muscle, and also you calm down the stressed body, and everybody who has such a positive test, you know, and starting with the first symptom, but the symptom can just come because of smoking or just a normal flu or whatever it is. But nowadays everything is in this box: COVID, 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 COVID. This is nonsense. That's really nonsense, and it's not the virus that makes the disease, you know. It's just the interaction of the system. And so if we start with the vagus concept, and our system is immediately starting with the vagus, the relaxation, and additionally with the right infusion, and there may be some special pills we use there, and just optimizing logistics, and especially de-stressing the system is the best remedy also for COVID.
Thank you, sir. And
You're welcome.
the last question, this is from my side, sir. Like, I would like to ask you, like, as you told us, like, it is a derailment of the process, and probably, like, with the help of the matrix rhythm therapy, we'll be able to get the rhythm and the coherence back and make the environment better. And after that, we really need to have a lifestyle modification to maintain that particular environment so that we don't get into derailment again. So can you please suggest what lifestyle modifications are important to be followed after you get a therapy, or even otherwise, like what lifestyle modifications are required for the system to be or the cell to have a good environment?
Well, so I can just tell you how I try to do it, you know, because one is the big talking from the books, but how do I? So, as you know, we are all working very much, but on the other hand, you know, we have to always look that we have a good sleep. And important is not the time of sleep. The question is, how do you wake up? Are you still tired when you wake up? That means, how can you recover? That means, how elastic is the body? That means, when you are like a sponge, you know, daytime it's squeezing your body, and in the night you should get logistics, water, and you should get recharged. That means when you can jump out of the bed like somebody who is maybe 20 years old, then you know your body is in a good system, and you do it with pleasure and so on, you know. That means it's you have to balance the system between sympathetic and parasympathetic direction. And most of the people are too much like a squeezed sponge or a squeezed lemon, you know. It means we have to go more and more to kind of massage techniques. And sorry to say, but you have a big tradition of Ayurveda, you know. And what I observed, for example, people go to yoga, but yoga asana is stretching the body, you know. But nobody, and I have so many yoga people here from Munich, yoga teachers, they have pain. This should never happen. But now I know why they have it, because exactly what you are just asking me, there is no relaxation of the muscle. That means when you stretch a muscle like a rubber band, it will always rupture at the weakest point. So you need metabolism, and this is done, the yin and the yang, the one is the yoga and the other one is Ayurveda. And even when I talk to some Swamijis, Gurujis, and Sadhgurus, whatever you have in India, I was talking with them, they are tight like this because nobody gets Ayurveda treatments. They just do yoga, meditation, but you can sing Om the whole day. Your muscle will not relax at all because the muscle needs nutrition, metabolism, and this you have to bring in by massage techniques. And then, of course, I will tell you this also. I was also one day in an ashram, and we compared, how deep massage techniques and matrix rhythm therapy go in to the body. And of course, because we are working in the resonance frequency of the body, we deeply penetrate the whole system. And in Ayurveda, you have also some kind of vibrational rhythms. You have it in the system, and now the people in these ashram, they say, the matrix mobile is a turbo panchakarma tool. That means you come much quicker into the system to relax the system by activation of the cellular metabolism to get the relaxation. So this is my answer when you ask me what to do is always look that your muscle body is at the end of the day relaxed and not stiff. And don't go too much to the gym, because the gym is always contracting. You can go to the gym when your muscle is relaxed. At the end of the day, everybody, as I just told here, what I wish you, stay elastic and relaxed. And this is what you just tell to yourself in the morning. How can I work today that at the evening I'm elastic and relaxed? This is my message, And this is how I try to do it. So let's see how it will end, But I think it is wonderful because you are able to do any sports every second because you are ready for it. You don't have, oh, it's hurting here or it's hurting here. You are free for the movement.
Thank you, sir. Thank you, sir. It was a great explanation. I think so without knowing that we are stressed out, we are already in a sympathetic mode. We still again go to a gym and then try to cause more of contractions, and probably we need to be more elastic and relaxed, and that is what can improve our immune system and also feel good, and probably all our systems can self-modulate themselves on their own. Thank you, sir. Thank you very much, sir.
I thank you. I thank you again very much, and I hope to see you very soon. Great time. Thank you.
Thank you, sir. Thanks for accepting our invitation, and maybe we will definitely see you in a different platform. Probably, as you said, physically when you come to India, I think definitely we will meet, sir. Thank you, sir.
I appreciate it. Thank you so much. Best regards to all the friends. Thank you.
Thank you, sir.